What is Peyronies disease? Peyronies disease is the abnormal curvature of the penis. The curvature can come on suddenly out of the blue or after a traumatic event. Dr. Peyronie was a French physician and who was a personal physician of Louis XV. So you can imagine who might have been the first person to be described with this condition. Peyronies disease cause is not entirely known. It's suspected to be due to microtrauma, which causes a small amount of scar tissue to form, and then a genetic condition which promotes abnormal scar tissue. And when you have abnormal scar tissue, abnormal scar tissue doesn't stretch like normal penile tissue. So what happens is, as the penis becomes erect, instead of growing straight out and bigger around, the scar tissue doesn't expand in the same way, which results in curvature usually in the direction of the scar tissue. Peyronies disease can impact both erections and ability to have intercourse. So when scar tissue forms, it can directly impact the amount of blood flow that goes into the penis, as well as how well the penis holds blood into the penis once an erection occurs. So it can make it more difficult to get an erection and more difficult to keep an erection. In addition, Peyronies disease can impact a man's ability to have intercourse in two different ways. First, if the erection isn't firm enough to penetrate, that is one way. If the erection is firm enough to penetrate, the curvature may make penetrating difficult or uncomfortable for the man or his female partner. Peyronies disease is usually diagnosed by the patient. First, an abnormal curvature is developed, and then the second thing that happens is the patient goes on Google and finds a diagnosis of Peyronies disease. It's usually pretty obvious to the patient and partner when it happened. Besides curvatures, sometimes hourglass, where the penis narrows either at the base of the shaft or out towards the distal or the end of the shaft, can also be noted. Once the patient presents to the doctor's office for curvature, it's a good idea to bring in with you a picture of the erection. You can take a snapshot from above and from the side so we can measure the amount of curvature as well as identify any other deformities such as indentation or hourglassing. There are several options available for the treatment of Peyronies disease, and there's a couple of important factors to help us make a decision. The first part is, are you in the acute phase or the early phase or versus the chronic phase, and how good is your erectile function, okay? So for the acute phase, there's a couple of options available. The first thing we recommend is getting a traction device such as the RestRx traction device and using it for an hour a day. This has been shown to reduce the loss of length associated with Peyronies disease, as well as the ultimate degree of curvature at the end of the acute phase. And you wear it for an hour a day, 30 minutes against the curvature and 30 minutes straight out. It's available online from RestRx.com. I strongly encourage men newly diagnosed with Peyronies disease to look and consider this option. The other options available, some men describe pain associated with their new Peyronie scar or plaque. Anti-inflammatory medications such as ibuprofen or Aleve are available for this issue. And the third option, which is available, is shockwave therapy. And although for erectile dysfunction, the use of shockwave therapy is quite controversial, in patients with Peyronie's plaque and pain in the acute phase, there may be some benefit in reducing pain associated with using shockwave therapy. But buyer beware, shockwave therapy does not reduce the ultimate degree of curvature. Next, once you've had a stable curvature for 3 months with no change, worse or better, you are in the chronic phase of Peyronies disease. And there are 4 treatment options available for this time. The first treatment option is the XIAFLEX, which are a series of 8 injections given over 4 to 6 months, as well as using the RestRx device to stretch and straighten the penis. This is a non-surgical option that's FDA approved and will improve the curvature by on average 20 to 30 degrees, and add a centimeter in length if you've noted length loss associated with your condition. The second two options are surgical options, and those are penile plication. This is the simpler of the surgical options. It requires either circumcising or a small penile shaft incision, and sutures are placed on the opposite end of the curvature. So if this is your curvature, sutures are placed on the opposite side to straighten the penis. This is a good option for men with plenty of length and good erections that don't want to undergo the risks of a penile implant or incision and grafting. The advantage to this over the injections would be that you would wake up with a straight erection right after surgery, and you'd be able to use that straight erection 6 weeks later versus 4 to 6 weeks of treatment with Xiaflex. But it is a surgical option, so that's something to consider. The other two surgical options, incision and grafting and penile prosthesis, really depend on your erectile function. Incision and grafting is available for men that have curvature and excellent erections and under the age of 75, but it has some risk. So incision and grafting, about 20-30% of men who undergo that procedure have worse erections after the procedure. The other risk is about 10% notice nerve damage to the end of their penis after this erection, but it can add length, and if your erections stay, it will have a straight penis. The last option is the penile implant, and the penile implant is for men whose erections aren't as good as they need to be to penetrate and have Peyronies disease, and you can straighten the penis and fix the erectile dysfunction in one procedure. So it cures both problems in a single outpatient procedure. How do we determine which treatment is right for me? So we look at several factors. The first is, are you in the acute phase or are you in the chronic phase? If you're in the chronic phase, you have the four options: the incision and grafting, the Xiaflex treatments, the penile plication, and the penile prosthesis, okay? The next question we want to ask is, how are your erections, okay? If your erections are not very good, either with medication or with injections, then probably the penile implant is the best choice for you. If you're young, you have indentation, and you have excellent erections, then maybe you ought to consider the incision and grafting. If you have plenty of length and want a treatment that's going to give you the straight penis the fastest, then the penile plication is your best bet. So you and I can sit down and we can decide which one is best for you based on what your treatment preferences are.